Today we'll talk about drug addiction because cannabis abuse is running rampant in our society right now. We doctors don't use the word addiction. We use a different term called dependence. And we do not label every person who uses a psychoactive substance as being dependent or addicted to the substance. The thing which classifies as a person as being dependent to a substance depends on a lot of criteria. A person needs to take a substance in a quantity more than a normal person would, at a frequency more than what a normal person would. When would a doctor call a person as dependent or addicted to a substance? It depends on a few things. The one is the person's increasing need for the substance, the need to take more quantity so as to feel the same high as before, the presence of a withdrawal symptom when he suddenly stops the use of the drug. This is when you call a person as addicted or dependent to the substance. Substance abuse is not limited to abusing or being dependent to alcohol, tobacco, cannabis, opioids, or other substances or other psychoactive substances. Abuse can also be related to non-addiction forming substances like steroids by bodybuilders, or for example laxatives by people who constantly take tablets for constipation. There are measures to come out of addiction. There are treatments available. There is a way out for people who are addicted. It involves going to a psychiatrist, taking detoxification treatment, which involves treatment to reduce any side effects which can come when you suddenly stop a substance, and finally taking a de-addiction treatment to reduce the craving for the substance to prevent a further use of substance. There is a false notion in cannabis users that cannabis does not damage your brain or your body. It is totally false. Even though it is legalized for medical use for certain conditions in certain countries, the regular use of cannabis will cause extensive damage to the brain and the body. There is a condition called cannabis-induced psychosis, and it is especially prevalent in young males between the ages of 20 to 30. The other major problems resulting out of cannabis use is emotivational syndrome, in which a person loses interest in life, loses interest in doing work, and prefers a very laid-back lifestyle and does not progress in life. There are also significant sexual side effects associated with the long-term use of cannabis. So beware when you hear a person saying that cannabis does not harm your body or your brain. Cannabis-induced psychosis is a state in which a person loses touch with reality. He may start hearing things which are not there, which are called hallucinations, or he might start fearing harm being done to him, a persecutory delusion, and it can also result in violence and agitation in the person, which might require him to be committed to a hospital. All psychoactive substances damage your brain. So if you stop early and you seek help, you'll be able to regain control of your life and lead a happy life.